Well, welcome to this Thursday's health and wellness presentation, Getting the Most Out of Movement. I want to welcome Diana Garrett, who is a physical therapist with performance therapy at Providence St. John's Health Center. And I'm Rebecca Crane-Okada. I'm the program manager for the breast services here. I'm a nurse and facilitating today. We will be recording and we will have time at the end for questions and answers. So take it away, Diana.
Awesome. Well, thank you, Becky. Like she said, I am Diana Garrett. I'm a physical therapist here at Providence St. John's Health Center, and I'm going to talk to you about how can we get moving and making it mean more. So Becky's our moderator, so thank you very much. And so what we're going to talk about today is kind of reviewing some of the possible side effects from breast cancer treatments, discussing the positive benefits of exercise, provide recommendation guidelines for physical activity, examine the effects of physical activity specifically for the breast cancer population, and present some examples to integrate into your routine. You're going to hear me interchange physical activity and exercise. They're kind of one and the same in my eyes. It doesn't have to necessarily be an organized exercise for it to count as physical activity. And we'll talk a little bit more about that later. So if we look at some of the studies that have been gone out, there's one study specifically that showed amongst 800 breast cancer survivors that their overall activity levels decreased by 2 hours after they received their diagnosis. So we're wanting to kind of push this kind of activity level because we want to make sure that we maintain a healthy lifestyle during and after treatments. And another study showed that approximately only about 20 to 30% of cancer survivors are meeting the public health exercise guidelines after treatment, and only 5 to 10% of them meet the guidelines during treatment. And a lot of the studies that have come out have shown really positive effects for kind of cancer prevention and treatment, but specifically in 7 different types of cancer, including breast, endometrial, kidney, bladder, esophageal, stomach, and colon cancer. So what are some of the side effects that we're seeing with breast cancer treatments, and how can exercise help? The biggest thing I hear from a lot of my patients is about fatigue, and we call it cancer-related fatigue because it's a little bit different. It's this persistent sense of tiredness or exhaustion that's related to the cancer itself or its treatments. It's kind of more beyond being just tired or being sleepy. It's this kind of daily, consistent fatigue, feeling tired. And it's reported about 70 to 100% of patients, depending on who you ask, and can last for several months to years after finishing treatments. And this might be due to anemia, chronic inflammation that occurs with treatments, maybe some depression, some altered metabolism, impaired nutrition, or just the effects of the medication on the central nervous system itself. So it seems counterintuitive, but one of the great things you can do to combat fatigue is to exercise. So during cancer-related fatigue, we see a decreased delivery of oxygen to the cells, which limits the amount of energy that can be created. This causes the heart and the lungs to have to work harder in order to sustain adequate oxygen supplies in the cells. Exercise or physical activity increases the delivery of oxygen to the cells and allows for more conversion into energy. It also increases your red blood cells, which helps kind of deliver that oxygen to the cells. And exercise is also thought to decrease fatigue by decreasing the neurotoxicity from treatments themselves and decreasing the chronic stress that affects the hypothalamic pituitary adrenal axis, which is just a really fancy way of saying the hub of where your cortisol is produced. So chronic stress and inflammation, we kind of pump up that cortisol. Exercise helps kind of diminish some of that and has good benefits to the body. Another side effect we see with breast cancer treatments is pain, or fancy term, arthralgia. So the pain might be due to surgery, radiation, or chemotherapy. It can be considered nociceptive pain, which has damage to the skin or the muscle or tissue, or neuropathic pain, where it's direct damage to the nerve. Sometimes this can happen during surgery. Sometimes this can happen as a side effect of radiation because you have nerves that are there, and they're kind of little byproducts of what happens. So exercise can actually help improve your pain. So exercise can alter the central processing of pain in your brain. And so it kind of decreases the signal from your receptors in your hands, your shoulders, your feet that send the signal to your brain to say, hey, I'm having pain. Exercise can kind of help diminish that pain processing. Some studies have also shown that combined training, which includes aerobic, getting your heart rate up, and resistance exercise, so using weights, decrease pain specifically in breast cancer survivors. Aerobic and resistance exercise is also shown to decrease some of the symptoms of chemotherapy-induced peripheral neuropathy, so that numbness and tingling that you have in your hands and your feet. We're still getting all the studies to try to figure out exactly where that's coming from and how we can help, but exercise seems to show to improve that, and that might be due to the increased blood flow to those little nerve endings. It can help regenerate them. Another side effect we see after cancer treatments is a sleep disturbance. So this can include difficulty falling asleep. Maybe you wake up before your alarm, you have difficulty staying asleep through the night, or you just have non-restorative sleep where you get enough sleep, but you just don't feel well rested. You still feel tired. And this has been reported in about 30% of patients, and some patients may even use medication to improve sleep. But as you can expect, exercise can actually help with that. In a study in 2015, it showed that moderate intensity walking exercise significantly improved sleep in cancer patients. So we think this happens because exercise positively affects the sleep-wake cycle. So we have this circadian rhythm, the sleep-wake cycle, that tells us when we should be getting tired as kind of the, it gets darker at night and we should be a little bit more awake at lighter times. And that's kind of what gets a little thrown off when we're traveling and having jet lag. And so exercise can help kind of reboot that cycle. And some patients reported to have an overall improvement in sleep quality and total sleep time after beginning a walk program. So sleeping for longer and getting better restorative sleep. Some other studies have shown that exercise can lead to an increase in blood flow to the skin and a rise in body temperature, which promotes sleep. So it's kind of similar to drinking like a tea at night, non-caffeinated, of course, or taking like a hot bath just to kind of increase your body temperature, which makes your body almost kind of prepped for a good night's sleep. We also see some cardiovascular changes in cancer survivors. This can be due to certain effects of different chemotherapy medications. Not all chemotherapy medications will have this effect, but some can. So what we'll see is not often, but sometimes we'll see structural changes in the heart. This can be a decreased stroke volumes, the amount of blood that the heart pumps out, an increased resting heart rate. So the heart might be pumping more often to kind of push through. A decreased ventricle mass. So the ventricle is one of the chambers of the heart, so that can actually get smaller, or an artery wall thickening to where the walls of the arteries where the blood flow goes through can actually thicken because of the effects of chemotherapy. We'll also see altered levels of red blood cells and platelets, which goes back to that fatigue and decreased oxygen to the cells. So exercise, of course, has a positive effect on your heart. Acute responses, so immediately after exercise or during exercise, is increased cardiac output. It's the increase in overall amount of blood that's pumped by the heart, and increased stroke volume, which is the quantity of blood pumped with each beat, and an increased heart rate. So your heart is pumping more blood per beat and more blood overall. So with continued exercise training, we see these changes that happen. We see an increase in red blood cells, increase in hematocrit, increase in hemoglobin, so more oxygen is being delivered, and increased ability to pump blood per contraction at rest. So we see those changes during exercise, and with continued exercise, we see those changes maintained when you're not exercising. So we create an overall more efficient heart. One of the big things we see in some of our cancer survivors is a suppressed immune system. So this can be suppressed during or after treatments. We'll see a lower number of white blood cells and maybe a decreased effectiveness of the immune cells. But there's enough cells, but they're just not kind of strong enough and fighting hard like they used to. So again, exercise. Physical activity, we see an increase in specific immune cells, including your natural killer cells, your monocytes and granulocytes, in addition to a decreased duration of neutropenia. So neutropenia is when your immune cells kind of drop, so we see a shorter duration. So if you look at this graph that I put on here, we see different intensities of exercise on the bottom. So sedentary, not moving much, moderate, and high. And then on the left side, we see a risk of infection from low to average to high. So if we kind of line up those axes, we see that if you lead more of a sedentary life, you have kind of an average or higher risk of infection. As you kind of move across into more moderate intensity exercise, that risk of infection actually dips down because we have more of those immune cells being fired off and generated. But if we continue and do high intensity exercise, so we're super stressing the system, we can actually increase the risk of infection because now there's more stress and strain on the body. So I try to aim for getting that moderate intensity exercise so we have the maximal benefits of our immune cells. And specifically, one study in breast cancer patients showed an increase in immune cells following a 15-week aerobic exercise routine. And this exercise routine was moderate intensity walking. So it's very achievable to boost your immune system with exercise. One of the other things that we see changing with cancer treatments is your musculoskeletal system. So we can see a decrease in lean body mass, so maybe some loss of muscle. We often see an increased fat mass or weight gain and some bone density changes. And of course, exercise can help with it all. So if we look at our bones, studies have shown that weight-bearing exercise have a significant effect on both femur and spine bone density. And this is kind of based off of something called Wolff's Law, where bone will kind of reinforce itself where it's stressed. So we want to have some of that weight-bearing exercise, including walking and stair climbing and hill walking, kind of integrated into, if you love swimming, that's great, but that's not weight-bearing. So we want to add a little bit of some weight-bearing into it. Some randomized control trials show that moderate intensity exercise lessen bone loss in breast cancer survivors, which is always very helpful as, some breast cancer survivors are taking aromatase inhibitors, which might accelerate kind of these things we see with menopause and degeneration of bone and bone density. So we want to kind of boost up with that exercise. And some follow-up trials also showed some increased bone mineral density in groups that did resistance training in addition to medication. So again, we're kind of stressing some of the bones because when muscles contract during resistance training, it pulls on those bones ever so slightly, and it kind of triggers that bone to say, all right, we need to reinforce, we need to be stronger here. Exercise can also improve your muscle mass and force generating capability. So just overall being stronger. It can increase tissue pliability and flexibility by changing the collagen fibers. So just being able to be more mobile, be stronger. And in the general adult population, they actually did a study looking at hand grip strength. So a greater hand grip strength, you have an overall 31% reduced all-cause mortality risk. So this is not specific to cancer in particular, but just looking at the general population, that the stronger people were, and they use hand grip because it's easy to measure, and they use quadricep strength also, the stronger people were, the longer they lived. So we want to make sure that we're getting up and getting moving.
Diana?
Yeah?
Can you back up to that previous slide, please?
Mm-hmm.
And can you clarify weight bearing? So that has nothing to do with lifting weights.
There's nothing to, no. So weight bearing can be anything where you're putting kind of force through your feet.
Okay. And then the other one was resistance training?
Resistance training is more kind of that weight training.
The actual lifting of weights.
Yes. Or bands, or, your choice. We'll be going over that later. Okay. All right. So we're just going to summarize the benefits of physical activity because there's a lot of them. It improves your aerobic fitness. It increases your muscular strength, improves your flexibility, improves your body composition. So more lean muscle mass, less fat mass, can improve the quality of life, boosts your immune response. You can decrease your pain, improve your sleep, improve your cognitive function, which is a whole nother lecture. And it's so amazing to see all the research that's coming out to support that, and can improve your treatment tolerance. So some of the things we'd like to just highlight before you start exercising. One is to avoid inactivity. We want to keep moving. No matter what you decide to do, to keep moving. The important thing is to keep moving. We want you to consider your prior exercise history. If you're someone who enjoys walking, don't set out to do a marathon right away. Let's look at where you started and build up from there. We want to allow for appropriate healing after surgery. I always like to get clearance from your surgeon before we start kind of pushing through and doing some exercises. We want to not exercise with extreme fatigue or anemia. Remember, we talked about how fatigue can be combated with exercise, but there's a limit, there's a line, and you know your body best. So we want to make sure that you're not exercising through fatigue, extreme fatigue. If you're a little bit tired, sometimes that can kind of help boost your energy levels. I often see it with my patients that come into the clinic to do some exercises, and they'll start off being like, yeah, I'm a little tired today. I'm like, all right, you know, let's pace ourselves. We'll do some things and kind of guide them through some exercise. And they leave being like, I feel like I have more energy. I'm like, great. That's exactly what we wanted. We, of course, want you to consider your immune function. If you're kind of going through treatments and you're having a suppressed immune system, going into a crowded gym might not be the best choice for you at that moment. So kind of get a little bit more creative with your exercises. And we always want you to consult your physician prior to starting an exercise program, making sure that everything is checking out before we start to push ourselves. So what are the exercise guidelines? We talked about how about 20 to 30% of breast cancer survivors are having 2 hours less physical activity. So what does that mean? So the exercise guidelines that have been put out by the National Cancer Institute in conjunction with the American College of Sports Medicine aim to have a moderate intense aerobic exercise. So that's getting your heart rate up 30 minutes a day, 5 times a week, which equates to about 150 to 300 minutes a week, or vigorous intense aerobic exercise, 20 minutes a day, 3 times a week, which is about 75 to 100 minutes per week. And we also want to add that strength training exercise. We want 8 to 10 exercises with 8 to 12 repetitions 2 times a week. So we want to get the heart rate going, but we also want the muscles to get going. So what does that mean? Moderate activity is you're working hard enough to raise your heart rate, maybe get a little sweat, but you can still carry on a conversation. We want you to be able to breathe and talk through your exercises. So that's where if you're going walking with a friend, and maybe you're breathing a little bit harder, but you're still able to have a good conversation. If we're going based on heart rate, we're looking at a 50 to 70% of your maximum heart rate. And we'll go over how to calculate that. Vigorous activity is more intense. You're unable to carry on a conversation. You're kind of huffing and puffing. You can get some words out in between taking a breath, but you're still kind of concentrating more on your breathing. And that can be up to 70 to 85% of your maximum heart rate. For my purpose, I'm going to say ignore that. We want to aim for moderate activity. A lot of the studies that have come out have really shown the benefits of moderate activity. So that's where I like to focus on. I think sometimes the vigorous activity can be a little bit too much. So I want to focus on getting that target heart rate between 50 to 70% of maximum. And that's going to be different for every single person. So if we look at our maximum heart rate, an easy way to calculate it is 220 minus your age. So if you're 50 years old, 220 minus 50, your maximum heart rate is 170. And I'm not great at math, so I can't calculate what, 85% of 170 is, but we can do that later. I have a little cheat sheet. So your heart rate can be taken a couple different ways. It can be taken manually or using a tracker, such as like a Fitbit or an Apple Watch, or they have little heart rate monitors at Target or Big Five. You can also take your pulse by placing your index finger and middle finger on the thumb side of your wrist, on the inside of it, just very lightly. You don't want to press too hard because then you won't feel the pulses. But count your pulse for about 30 seconds and multiply by 2. Again, I'm not great at math, so I use my Apple Watch. I think they're really handy. They're usually fairly accurate too. So this is my handy dandy chart. So I'm going to keep this up for a moment. So on the left, you can see kind of your ages. In the middle is your target heart rate zone for 50 to 85%. And on the right is the average maximum heart rate at 100%. So we don't need to worry too much about the maximum. But if we look kind of in the middle, it gives us a nice target heart rate zone to work through. So some people might find it more comfortable to work kind of towards that lower end. Some people might find it more, more challenging to work towards the upper end, but we kind of want to keep our heart rate between those ranges. So if we look at the 50-year-old, a target heart rate for between 50 to 85% would be 85 to 145 beats per minute. And that doesn't have to be necessarily sustained throughout your entire exercise. That can kind of fluctuate as you take rest breaks, but that is our target heart rate zone for a 50-year-old. So what does different intensities look like? So we have different examples of light intensity, moderate intensity, and vigorous intensity. And again, this is going to be very different for each person. If I'm trying to think of a popular cyclist, and I can only think of Lance Armstrong. If I'm Lance Armstrong, I'm going to say biking faster than 10 miles per hour is going to be a piece of cake. That's probably going to be more moderate for him. He might have to go faster than 20 miles per hour. I'm not sure. But it kind of varies. My mom loves to garden, and I use her as a great example. So gardening falls into a moderate intensity. But if she's planting a tree or a rose bush, or she's really going to town, pulling up those weeds, that might go into more of her vigorous intensity based on her heart rate and her max heart rate. So this is kind of a fluctuating thing here. You can kind of pick what works for you. But it's a good place to start to think of moderate intensity as more kind of brisk walking, maybe picking up the pace a little bit versus kind of slow, leisurely walking. Yoga is always a great example of moderate intensity exercise, unless you're doing like headstands, that might be more vigorous intensity. So it can be tailored to each person individually. So if you look at strength training, which is what I love to have my patients do. I love seeing them getting stronger and feeling more empowered. You can do it through various methods. You can do it with resistance bands. You can use weights. You can use water bottles or canned goods or bags of flour or children, whatever you have lying around the house, you can pick up. You can also just do really great exercise with just your body weight. Doing squats and lunges are still very challenging and very difficult with just body weight. You don't necessarily have to add weight for that additional challenge. But a great principles to go off is don't start with heavy resistance. You want to build slowly. So maybe starting with that body weight, adding a water bottle or two. We want to perform 2 to 3 sets of 8 to 12 repetitions. So doing it, let's say 10 times, doing a squat 10 times, take a break, do another set of it, move on to your next target group. The big muscle groups that we like to target are your gluteals, which are your buttocks, your quadriceps, the front of your thighs, your core, your abdominals, your back muscles, because that's really important for posture, your shoulders, and your chest region. So some examples are sit to stands, which is just a bunch of squats. If you watch yourself when you stand up from a chair and you go to sit down, you're going through a squat, and it's a great place to start in terms of strength training. You can add holding a weight, or you can add not sitting all the way down, pretending that the seat is super hot, and you go to sit down, you come back up right away, and that essentially is a squat. You can do some push-ups with or without modifications. You can do wall push-ups. As you get flatter towards the floor, the harder it becomes to do a push-up. So you could start maybe at a wall, and then maybe go to a countertop, and then maybe go to a bench, and then maybe go to the ground as you build up your strength. Bridges or hip thrusts, or I call them Jane Fondas, are a great exercise for your gluteals and your hamstrings. So you can start off with just lying on your back and lifting your hips. You can make changes by putting your feet on things, maybe adding a band around your knees, maybe going to one leg, which is super tough. And there's always ways to make something a little bit more challenging. And then, of course, your arms. We can do kind of an overhead pressing up, some bicep curls, some tricep kickbacks, some rows, some flies, which is a little bit of a chest press. And that can be done with weights, with bands, water bottles, whatever kind of fits your environment best. And just some clinical pearls for exercise. We want to slowly work up to building the tolerance for 30 minutes of aerobic exercise. So the guidelines say 30 minutes per day, 5 days a week. Now that 30 minutes doesn't have to happen all at once. You can break it up. You can do it in 10-minute increments. It all adds up. It all counts. It doesn't have to be a full 30 minutes in order to count. You could say, all right, I'm going to go for a brisk walk in the morning, 15 minutes. I'm going to go for another brisk walk in the afternoon, 15 minutes. And that's your 30 minutes of aerobic exercise. If you feel any pain while you're exercising, we recommend you to stop. Let's figure out where that pain is coming from. But having some soreness or some discomfort afterwards is okay. Some muscle soreness after exercise may develop within 24 to 36 hours after your activity, but you should still be able to complete your normal daily tasks. Sometimes when I go and exercise and I kind of lose track of what I'm doing and I get carried away, the next day coming out of those steps out of my apartment, I'm like, ooh, I feel it in my quads, they're sore. And I can make my way through the day, then it gets a little bit better and it doesn't stop me from what I'm doing. But when it's like, it's really hard to sit down, like to sit in my car and get out of my car because my muscles are so sore, I know that I did too much. So we want to find that nice balance of where maybe you're a little bit sore afterwards because you know that your muscles were working, but you're still able to do everything. We want to make sure that you really stay hydrated both during and after exercise and that you're nourished. We want to make sure that you have something in your tank, in your gut, so that you have energy to expend while exercising. It's never great to exercise on an empty stomach because it can make you a little bit lightheaded, a little bit nauseous. So we want to make sure that you eat a little bit of something before you exercise to give you some fuel to burn, and then making sure you replenish that afterwards. And you can talk to your nutritionist or dietitian for extra little pearls on that one. If you become dizzy or lightheaded or have difficulty breathing or are nauseous, we want you to stop exercising and consult with your physician. That can be due to multiple different reasons. Maybe check to see if, did you drink water that day? Have you eaten that day? If everything seems to check out and you're still having those symptoms, definitely want you to follow up with your physician. Again, I put on here avoid inactivity because I just really want to drive that home that we want you to get up and move. Moving is so important for your overall health that we just want you to continue to do it. And if you're unsure about where to start, you can always consult a physical therapist. I love getting people started on little exercise programs and seeing where they want to go with it, and tailoring things specifically to their needs. I just want to say thank you. These are a whole bunch of my references if you're ever interested in any of them. And I think we'll take some questions.
Thank you, Diana. That was great. So just unmute yourself if you have a question for Diana. I thought your table with different activities was really helpful to see.
Yeah, and remember, it's very individual. So everyone kind of has different activity levels and what they consider to be challenging. And it's important to figure out what is challenging to you and where to start.
I think the important issue, one of the important issues that you touched was fighting the fatigue, because that is so common. And it's counterintuitive to think if you're tired, you should get up and go do something. If you're tired, you should just rest. So that kind of hit me again because it's one of those things I keep putting out in my head because I'm tired.
Yeah, I mean, I think it's difficult to determine the difference between feeling fatigued and feeling tired. And I think that's when you kind of look to be like, all right, did I get enough sleep? Yeah. Well, why am I so tired? Well, maybe it is the fatigue. Maybe let's go for a walk and see if I feel better. You don't have to necessarily jump into a big exercise routine and workout to be like, I got to bust this fatigue. You just kind of be like, all right, I'm going to go for a little bit of a walk. If you start to feel better, then all right, it's that fatigue and I need to get moving a little bit more.
Great, thank you. Becky, I think she would like my mud girl.
Yeah, tell her about that. Tell everyone about that.
It's a 3-mile obstacle course in the mud. And I booked it for October 1st, so hopefully I can do it, but I'm going to do it regardless.
That's awesome.
Wow.
I think walking gets a bad rap.
I think walking is starting to become trendy again. There is a lot of Instagram influencers out there promoting walking on an incline on a treadmill. And it's gaining steam, which is great because it's something that everyone can do in terms of just getting out and walking. And I've seen more people walking. I think with COVID, it's definitely motivated some people to get out a little bit more because you didn't have any other options. And hopefully it continues to kind of get the recognition that it deserves, that walking is a great form of exercise that everyone can do.
Mm-hmm. Can you speak to how competitive we can be in classes too, and how we prevent ourselves from being competitive? Because I think there's, yoga isn't good enough. It needs to be hot or something else, or power yoga or power Pilates. It's like the simplest exercise somehow becomes much bigger because the basic is not good enough. Can you speak to this?
Yeah, I think that's challenging because I tend to be a competitive person in classes also, and having to kind of remind myself, calm down, you're doing it for yourself. I think the first thing is to recognize where you're starting off at. Some of those Pilates classes are insane, and that's not a great place to start for someone who hasn't done Pilates before or is recovering. So kind of having that self-reflection as to like, this is what I'm working with right now. So this is what I'm going to do that's best for me right now. If you really are wanting to go into those intense Pilates classes, hot yoga, standing on your head and doing all those things, that's a great goal to have, but that might not be a place to jump in to start with. I think to each their own. I think hot yoga is great for some people, not great for others. I hate the heat. It's not a great place for me. If you have kind of some cardiac heart issues, it might not be a great choice for you. And just having to recognize that you as an individual have your own needs and just go for that. It doesn't matter what everyone else is doing and what the latest fad is. You can just tailor it to yourself.
Are there other questions?
That's great.
Diana, I apologize. Did you have a question?
No, it was great.
Diana, if someone wanted to consult with a physical therapist, how would they go about doing that?
Yeah, so because we are in the hospital system, we do require referral from either a physician assistant, or a nurse practitioner. That way we can also bill your insurance, which is great. So you can almost get like this personal training session that's geared medically towards you, covered by your insurance. So we just require a referral, and you can give our clinic a call. We'll get you scheduled and do an assessment to see where you're at, where's your strengths, where's your weaknesses, what do we want to work on, set some goals together, and kind of go from there.